confident are you that this $208 million in savings from the malpractice changes, will actually materialize? Where do those numbers come from?
Absolutely. Actually, it's pretty much guaranteed in the sense that it comes from two sources. One, lower payments to hospitals through the Medicaid program, which in essence, we've worked out a way to do that directly. So those savings will be guaranteed to the state. That's the big chunk, the largest portion. The rest of it comes from this new fund that will be created to cover the healthcare expenses of children who have had bad birth outcomes, and as a result, those will offset costs directly that the program's currently paying today. So we have, basically, we feel a very high degree of confidence that will generate the entire savings.
And how much of the hospital savings, the $640 million, is going to come from the malpractice changes? Can they just absorb that through savings they get through insurance premiums going down, or is that going to be coming later?
No, in a sense, the hospitals, and I do think it's important to point out that the full impact of medical malpractice reform to the hospitals will take a couple of years to be felt. That said, I think the industry has said we're willing to give the state immediate savings in exchange for this vital reform, because we realize just how important it is. And this medical malpractice reform in New York is not a new issue. People have been talking about it and working on it and debating it for many years. This is, I think, one of the first times we've tried to basically ensure that Medicaid got its fair share of savings from the initiative, and that's what I think makes it so significant today.
But why does Medicaid get the savings up front right away and the hospitals have it down the road?
Well, I mean, in a sense, the idea is that, this was about saving money in the Medicaid program. And eventually, in a year or two, the full impact will be felt by the industry, not just for the Medicaid population, but even more broadly than that. The hospitals will see benefit across all the patients that they serve, commercial as well as Medicaid. So I think they realized that it was in their best interest to give the state immediate savings.
What about this ethics complaint that's been filed against the redesign team, saying that the way it was carried out really essentially violated New York State ethics law?
Well, I think it's ridiculous, actually. The whole point of this process was to engage stakeholders. And by their very nature, stakeholders have a stake in the outcome of the process. We didn't want just 27 people who knew very little about the program, who didn't have a direct interest in the outcome of the work, to be part of this process. We actually invited specific people because they had expertise, they had knowledge, and they would come to the table representing their interests as an industry. And that was what I think is so historic about this, is that we were able to get these diverse groups who usually spend most of the time fighting each other behind closed doors to work together in a public setting and come up with a comprehensive plan. And I think that's what's so historic about this particular work product.
But if you look at the historic citation, the legal citations they have that back up their argument, it doesn't sound like it's ridiculous.
I'm not a lawyer, but I can tell you is that just a couple of years ago, there was a similar task force of stakeholders that was brought together by Governor Spitzer, and the organization that's raising this complaint was one of those stakeholders.
The question is, though, are you looking at their argument at all, or are you just going to say they're ridiculous?
The lawyers are, of course, going to be part of the process of reviewing the complaint if it moves forward.
Thanks, everybody.